Go near the temple for the tsunami-safe refugee area. Our event is held at the Graha Paruman Ballroom. In case of emergency, follow the exit route and gather around His Excellency Dr. Dante Saxono Harbuono, Vice Minister to the Ministry of Health to the Republic of Indonesia. His Excellency Professor Syahrul Yassin Limpo, Minister of Agriculture of the Republic of Indonesia. His Excellency Insinyur Sakti Wahyu Trenggono, Minister of Marine Affairs and Fisheries of the Republic of Indonesia. Her Excellency Professor Siti Nurbaya Bakar, Minister of Environment and Forestry of the Republic of Indonesia. Honorable Professor Hanan Balki, Acting Director General of AMR WHO. Honorable Dr. Javier Marcos, Head of the AMR WOAH. Honorable Professor Dame Sally Davis, UK Special Envoy on AMR. Honorable Doctor of Dental Medicine Murthy Utami, Acting Director General of Health Services at the Ministry of Health of the Republic of Indonesia. Honorable Professor Ramanan Laksmi Narayan, Board Chair, GARDP. Honorable Dr. Junxia Song, Senior Animal Health Officer, FAO. Honorable Mr. Love Agarwal, Joint Secretary of the Ministry of Health and Family Welfare, India. Honorable moderators of this side event, Professor Pratiwi Sudarmono from Universitas Indonesia and Dr. Anis Karuniawati, Chair of AMR Committee Indonesia. Honorable delegates of G20 member states, invited countries, and international organizations, distinguished participants and speakers. A very good morning to all of you and welcome to Paruman Ballroom of Hilton Resort Nusa Dua, Bali. It is an honor for me to be here. Allow me to introduce myself. My name is Riri Sulistiawati, your Master of Ceremony for the third Health Working Group side event in conjunction with G20 Indonesia Presidency 2022 in the spirit of Recover Together, Recover Stronger to tackling antimicrobial resistance. We are pleased that some of you are able to join us in person today, while some others are joining virtually. We do hope that you're enjoying our hospitality. For those of you who join us virtually, we do hope that you may be able to attend a meeting in Indonesia in the near future. Well, ladies and gentlemen, to warm up our morning, may I please have a big round of applause to all of you here? Thank you very much. Before we start the agenda of the day, please be advised about the arrangement of this event. Later on, coffee and snacks will be provided free flow at the foyer of this room. And we plan to conclude our agenda at 1:05 p.m. Well, Excellencies, distinguished delegates, ladies and gentlemen, our side event will commence with opening remarks from the Vice Minister, Ministry of Health of the Republic of Indonesia. May I have a big round of applause for His Excellency, Dr. Dante Saxono Harbuono.
Honorable delegates, distinguished speakers, ladies and gentlemen, good morning and welcome to the beautiful island of Bali. Since the invention of antimicrobials 70 years ago, millions of people have avoided diseases. The potential of antibiotics to treat or to prevent disease has led to an increase in their use for the point where they are commonly abused. Obtained without a prescription and frequent misuse across human, animal, plant, and the environments. Consequently, antimicrobial resistance AMR emerged. Ladies and gentlemen, the COVID-19 pandemic struck us like a tsunami, where AMR is more like a rising tide. Although it is evident the prevalence continues to rise, currently we have 1.27 million people die annually from drug-resistant infections. More and more prevalent diseases are untreatable. Life-saving treatments are becoming considerably riskier, and healthcare expense increase as a result, longer hospital stay and sickness duration. AMR's widespread impact continue to increase silently in multiple sectors, including economic. Expert estimate AMR might cause global annual GDP to fall by 3.8% by 2050. We must prevent this from happening and make a change that lasts. Ladies and gentlemen, in the spirit of strengthening the global health architecture, we must refocus our effort on tackling AMR. As health leaders from the largest economy together, we can contain AMR through the following elements. First, enhancing one of health approach to AMR surveillance, laboratory capacity, and diagnostic. Standardized and cross-sectoral surveillance for antimicrobials use and consumption is essential for understanding and monitoring antimicrobial resistance. Adequate data also influence political decision and science-based action at the national, regional, and global levels. Second, enhancing AMR research and development. On new medicines, vaccines, therapeutic, and diagnosis tools, including quality assures, antimicrobial diagnosis services, prevention measures, and border infection prevention and control IPC initiative. And the third one is increasing investment in research, capacity building, and technology transfer. AMR treating the health, economy, and attain of SDGs. In order to grow global research and development capacity, we must secure sufficient and sustainable funding. Ladies and gentlemen, just like COVID-19, AMR ignore borders. It might be silenced, but at the same time, that is why it is even more dangerous. The control of AMR cannot be sole responsibility of medical professionals and scientists. General population and other stakeholders have a crucial role in these public health concerns. It is necessary to implementing political law and constant commitment to ensure responsible access and use antimicrobials. We look to the G20 members country to cement sustainable AMR prevention and control measures at national and global level. The G20 is ideal forum to do this. Only by working together, we will be changed we all want to see. With this G27 side event on tackling antimicrobial resistance is officially open. Let us recover together and recovery together. Stronger. Thank you very much for your attention.
Thank you, His Excellency Dr. Dante Saxono Harbuono. Now, let us hear the welcome remarks from the Minister of Agriculture of the Republic of Indonesia to His Excellency Professor Syahrul Yassin Limpo. The screen is yours.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera, salam sehat bagi kita semua. Yang saya sangat hormati Menteri Kesehatan Republik Indonesia, Insinyur Budi G. Sadikin, CHFC, CLU, dan yang sama saya hormati Insinyur Sakti Wahyu Trenggono, MM, EPU, Menteri Kelautan dan Perikanan. Yang sangat saya hormati Menteri Lingkungan Hidup dan Kehutanan, Profesor Dr. Insinyur Siti Nurbaya, MSc, Dr. Hanan Baiki, Asisten Direktur Jenderal AMR FAO, Dr. Jeffrey Yukerus Marcos, Kepala AMRW OHH, Profesor Dame Sadli Davis, Utusan Khusus Inggris untuk AMR, hadirin yang sama berbahagia. Selamat pagi dan salam ketemu di Indonesia. Pertama-tama mari kita panjatkan puji syukur kehadirat Tuhan Yang Maha Esa karena atas segala perkenannya pada pagi hari ini kita sama-sama dapat menghadiri pertemuan side event G20 terkait penanganan resistensi antimikroba. Pada kesempatan yang baik ini saya menyampaikan ucapan terima kasih dan penghargaan yang setinggi-tingginya kepada pihak-pihak terkait yang telah bekerja sama dalam memfasilitasi dan mengkoordinasi pertemuan ini, dan kami sampaikan ucapan selamat datang dan berkunjung ke negara tercinta Republik Indonesia, khususnya di Pulau Bali, kepada perwakilan anggota G20 dan undangan lainnya. Bapak, Ibu, dan hadirin yang berbahagia, sebagaimana diketahui bersama bahwa meningkatnya populasi manusia dan maraknya aktivitas manusia yang berpengaruh terhadap degradasi lingkungan telah berdampak secara signifikan pada kompleksitas ancaman kesehatan dan perkembangan epidemiologi penyakit infeksi baru di dunia. Hal ini menyebabkan pendekatan dalam pengendalian penyakit yang kita hadapi saat ini semakin sulit untuk dapat dipecahkan oleh hanya satu sektor saja. Dalam hal ini pendekatan konsep One Health, kesehatan terpadu, memberi kita pilihan untuk memastikan bahwa seluruh pemangku kepentingan dari disiplin ilmu yang berbeda dapat bersama-sama terlibat untuk menyelesaikan permasalahan demi tercapainya kesehatan dan kesejahteraan masyarakat yang berkelanjutan. Di Indonesia hal ini telah diatur dalam Instruksi Presiden nomor 4 tahun 2019 tentang peningkatan kemampuan dan dalam pencegahan dan mendeteksi, merespon wabah, penyakit pandemik global, dan kedaruratan nuklir, biologis, dan kimia yang juga mengamanatkan pengendalian resistensi antimikroba. Hadirin yang kami muliakan, dalam beberapa dekade terakhir, laporan berbagai negara mencatat adanya peningkatan laju resistensi antimikroba. Namun di sisi lain, penemuan dan pengembangan jenis antibiotik atau antimikroba baru berjalan sangat lambat. Dengan kata lain, pola peningkatan laju resistensi sudah berbanding terbalik dengan penemuan obat antimikroba baru. Hal inilah yang mendasari isu resistensi antimikroba berkembang menjadi tantangan global yang sangat penting dibahas dalam berbagai forum internasional dan dipandang sebagai salah satu ancaman serius untuk segera ditangani. Bagi sektor peternakan dan kesehatan hewan, harus dapat kita pahami bahwa resistensi antimikroba merupakan ancaman serius bagi keberlanjutan ketahanan pangan di samping pembangunan kesehatan hewan yang berkelanjutan. Hadirin yang semua kami muliakan, pada tahun 2016, laporan review global perkembangan resistensi antimikroba menggambarkan model simulasi di mana kejadian resistensi antimikroba diprediksi akan menjadi pembunuh nomor 1 di dunia pada tahun 2050 yang akan datang. Dengan tingkat kematian akan mencapai 10 juta jiwa per tahun dan kematian tertinggi terjadi di kawasan Asia. Gambar ini akan mungkin terjadi jika saat ini masyarakat internasional tidak memiliki upaya yang konkret dalam pengendalian penggunaan antimikroba itu. Bapak, Ibu, dan hadirin yang sama saya hormati, Kementerian Pertanian menyadari peran strategis kami dalam memerangi laju resistensi antimikroba. Untuk itu, Kementerian Pertanian bersama-sama kementerian dan lembaga serta pemangku kepentingan terkait telah menyusun rencana strategis serta peta jalan upaya pengendalian resistensi antimikroba. Kami berharap langkah-langkah kita ke depan akan semakin kuat dan terpadu dalam rangka kerjasama One Health itu. Upaya kita dalam menghadapi bahaya resistensi antimikroba telah dilakukan dengan diberlakukannya peraturan penggunaan antibiotik di bidang peternakan dan kesehatan hewan yang tertuang dalam Undang-Undang Nomor 18 Tahun 2009 tentang peternakan dan kesehatan hewan yang melarang penggunaan antibiotik sebagai imbuhan pangan atau antibiotik growth promoter. Selanjutnya, sebagai upaya kami dalam mendukung kesehatan manusia, Kementerian Pertanian telah melakukan peraturan terkait pelarangan penggunaan colisting pada ternak yang produknya untuk konsumsi manusia melalui keputusan Menteri Pertanian nomor 9736 tahun 2020. Hal ini dilakukan karena colisting merupakan antibiotik pilihan terakhir bagi kesehatan hewan atau kesehatan manusia. Last drug of choice. Seperti itu adalah pilihan-pilihan terakhir untuk kepentingan kesehatan manusia. Bapak dan hadirin yang berbahagia, kami menyadari bahwa segala upaya yang dirancang dan direncanakan tidak akan optimal dalam implementasinya tanpa dukungan dan peran seluruh pemangku kepentingan yang terkait. Tantangan dalam memerangi laju resistensi antimikroba harus dipandang sebagai kewajiban dan tanggung jawab kita semua. Untuk itu mari kita senantiasa berupaya meningkatkan kompetensi profesional kita serta untuk menjaga agar efektivitas antimikroba tetap memberi manfaat bagi kehidupan secara lestari dengan menggunakannya secara bijak, cerdas, dan tentu bertanggung jawab. Akhir kata, semoga Tuhan Yang Maha Esa meridhoi dan memberi kemudahan atas usaha-usaha baik kita semua, termasuk hasil dari pertemuan kita pada kesempatan ini. Terima kasih atas segala kehadiran dan atensi kita, khususnya dalam pertemuan di Bali, Indonesia ini. Sekian, selamat berlakukan pertemuan, ridha Allah bersama kita. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, His Excellency Professor Syahrul Yassin Limpo. Ladies and gentlemen, our welcome remark session will continue, delivered by the Minister of Marine Affairs and Fisheries of Indonesia. To His Excellency, Insinyur Sakti Wahyu Trenggono, the screen is yours.
Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi, salam sejahtera bagi kita semua. Om Swastiastu, Namo Buddhaya, salam kebajikan. Yang saya hormati Menteri Kesehatan Republik Indonesia, Menteri Pertanian Republik Indonesia, Menteri Lingkungan Hidup dan Kehutanan Republik Indonesia, para narasumber, serta para peserta G20 Side Event Tackling Antimicrobial Resistance yang berbahagia. Puji syukur kita kepada Allah Subhanahu wa Ta'ala atas rahmat dan karunia-Nya, sehingga pada pagi hari ini kita dapat hadir pada acara G20 Side Event Tackling Antimicrobial Resistance di Bali. Hadirin yang saya hormati, resistensi antimikroba merupakan salah satu tantangan kesehatan terbesar di berbagai dunia dan telah ditetapkan sebagai salah satu dari 10 ancaman kesehatan terbesar masyarakat dunia. Penggunaan antibiotik yang tidak bijak telah ditengarai sebagai faktor pemicu meningkatnya kejadian resistensi antimikroba. Berdasarkan laporan terakhir dari Badan Kesehatan Dunia WHO, menunjukkan bahwa Asia Tenggara memiliki angka tertinggi dalam kasus resistensi antimikroba di dunia. Bahkan menurut penelitian Jim O'Neill pada tahun 2016, kegagalan penanganan resistensi antimikroba akan mengakibatkan 10 juta kematian setiap tahun dan diperkirakan menghabiskan biaya hingga $100 triliun pada tahun 2050. Kementerian Kelautan dan Perikanan menyadari sebagai institusi yang memiliki posisi strategis terhadap penyediaan pangan dari sektor perikanan akan selalu berkomitmen untuk ikut berperan aktif dalam upaya pencegahan resistensi antimikroba. Hadirin yang saya hormati, meningkatnya laju akan permintaan produk perikanan dari tahun ke tahun menunjukkan bahwa tingkat konsumsi ikan semakin meningkat. Sebagai salah satu produsen terbesar perikanan dunia, Indonesia tertantang untuk terus berupaya melakukan peningkatan produksi perikanan untuk memenuhi kebutuhan konsumsi dari sektor perikanan. Kami melihat dan sangat mengerti bahwa kesehatan ikan dan seluruh produk perikanan bisa berpengaruh terhadap kesehatan manusia, sehingga penting bagi masyarakat dan pelaku usaha untuk sadar dan mengerti tentang hal ini. Hal ini memicu kami untuk melakukan pemetaan sebagai dasar dalam menentukan action plan untuk mengendalikan ancaman resistensi antimikroba sampai ke tingkat wilayah-wilayah yang rentan mikroba. Sebagai bentuk komitmen, Kementerian Kelautan dan Perikanan ikut mengambil bagian dalam menyusun rencana aksi nasional pengendalian resistensi antimikroba. Beberapa kegiatan yang telah dilakukan antara lain peningkatan kesadaran dan pemahaman tentang pengendalian resistensi antimikroba melalui komunikasi, pendidikan, dan pelatihan. Peningkatan pengetahuan serta bukti ilmiah melalui pengawasan dan penelitian, pengurangan insiden infeksi melalui tindakan sanitasi, higienis, serta pencegahan dan pengendalian infeksi. Optimalisasi pengawasan serta penerapan sanksi tindak lanjut terhadap pelanggaran peredaran dan penggunaan antimikroba yang tidak sesuai standar pada bidang perikanan. Peningkatan investasi untuk menemukan tata cara pengobatan, metode diagnostik dan vaksin baru dalam upaya mengurangi berkembangnya masalah resistensi antimikroba di bidang perikanan, serta pembangunan tata kelola dan koordinasi terpadu dalam rangka pengendalian resistensi antimikroba di sektor perikanan. Bapak, Ibu, dan hadirin sekalian, guna mewujudkan sistem kesehatan nasional, Kementerian Kelautan dan Perikanan akan mengoptimalkan pendekatan One Health melalui berbagai data dan informasi hasil pengawasan. Kementerian Kelautan dan Perikanan akan terus berkomitmen meningkatkan kesiapan dalam mencegah, mendeteksi, dan merespon dampak penggunaan dan resistensi antimikroba terhadap kesehatan masyarakat yang berasal dari hasil perikanan melalui komunikasi, koordinasi, dan kolaborasi multisektoral bersama kementerian, lembaga, dan seluruh stakeholders terkait lainnya. Hadirin sekalian yang kami hormati, demikian yang dapat saya sampaikan. Semoga acara ini bermanfaat bagi kita semua, dan semoga apa yang kita laksanakan pada hari ini menambah kuat kolaborasi dan kerjasama antar seluruh pemangku kepentingan. Terima kasih. Wabillahi taufik wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh. Om Santi 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 Om.
Thank you, His Excellency Insinyur Sakti Wahyu Trenggono. Excellencies, distinguished delegates, ladies and gentlemen, more to welcome us with her remarks, let us welcome the Minister of Environment and Forestry of the Republic of Indonesia, Her Excellency Professor Siti Nurbaya Bakar. The screen is yours.
Excellency Professor Sally Davis, UK Special Envoy on Anti-Microbial Resistance AMR, along with Dr. Balki from World Health Organization and Dr. Marcos from World Organization of Animal Health, all invited speakers, distinguished participants from all stakeholders on AMR issue. Greetings from Jakarta. In today's event, it is heartening to speak at the opening session of this important side event, together with my dear colleague, Excellencies Minister of Health, Budi Sadikin, Minister of Agriculture, Professor Dr. Syahrul Yassin Limpo, and Minister of Marine Affairs and Fisheries, Mr. Sakti Wahyu Trenggono. Altogether, we acknowledge that the global community is taking the threat that antimicrobial resistant AMR poses to human health seriously. Excellencies, distinguished delegates, ladies and gentlemen, the COVID-19 pandemic is a wake-up call to better understanding and improve all areas of preparedness for and prevention of infectious disease, including their environmental dimensions. The COVID-19 pandemic provides lessons learned, one of which is the need to prevent and tackle various health and environmental threats concurrently. Antimicrobial resistance AMR has been emerging as a threat to global health and other risks affecting the environmental sustainability of the planet. Up to this moment, global attention to AMR has been mainly focused on the health and agriculture sectors. However, it should be kept in our mind that the environment is also a primary influencing factor to the development, transmission, and spread of AMR to humans, animals, and plants. Grounded upon these notions, during the 5th session of the United Nations Environment Assembly, UNEA, early this year, the United Nations Environment Programme, UNEP, launched a report on environmental dimension of antimicrobial resistance that comprehensively outlined the challenge and potential solution for tackling EMR within an environmental framework. The report highlighted that many human activities create pollution, which promotes the emergence of EMR in the environment. EMR in the environment can cause animal or plant disease or soil biodiversity loss that can lead to the further use of antimicrobials. The environmental dimension of EMR are characterized by cyclic interrelationships, their complexities, and multiple causalities and dynamics. A systemic approach, such as One Health, is recommended to better understand that environmental dimensions of EMR and inform science-based decisions and actions. Excellencies, distinguished delegates, ladies and gentlemen, the Ministry of Environment and Forestry is continuously engaging EMR issues in several areas, with recent emphasis on first, medical waste management sector. Secondly, the use of antimicrobial agents in wildlife care, as well as research on new nature-based antimicrobial sources. Firstly, on improving medical waste management. Currently, the management of medical waste also covers the antibiotic residue from health facilities, as regulated by the Ministry of Environment and Forestry Decree number 56 on year of 2015 on procedures for the technical requirement for hazardous and toxic material. Medical waste from health facilities shall be destroyed immediately or must be stored in cold storage at designated facilities in each province or district. Secondly, on handling EMR issue in the use of antimicrobial agents in wildlife care. As we all might be aware, approximately 75% of emerging infectious diseases are zoonoses. It is therefore in the country's wildlife management sector, we have preventive measures for antimicrobial resistance by examining bacteria and antimicrobial resistance. The measures also include testing antibiotic sensitivity in a reference laboratory before treatment. Monitoring and antimicrobial use AMU on wildlife has been managed by developing a surveillance system of disease in wildlife ex situ. Other than that, the Ministry of Environment and Forestry has also developed a surveillance system. We call it Kesehatan in 39 technical implementing units. The system will also include monitoring of the residue of antimicrobials to promote prudent use in antimicrobials. Thirdly, on the issue on bioprospecting, to discover new potential antimicrobial substances from the nature. Some researchers suggest that potential use of bacteria contained in the saliva of Komodo dragon, one of the endemic species in Indonesia. The discovery of this bacteria would be a potential bioprospecting since the Komodo dragon appears to be immune from the bacteria and thus more research are needed to utilize the bacteria for human health benefits. Excellencies, distinguished delegates, ladies and gentlemen, to conclude my remark, I would like to reaffirm that strengthened multilateral cooperation is essential to provide an enabling environment in addressing antimicrobial resistance-related issues. And now, with all existing scientific advances and policy options, it is the time for the G20 to lead concrete actions for this to be achieved in all countries across the globe. I thank you and have a fruitful discussion.
Thank you, Her Excellency Professor Siti Nurbaya Bakar. Ladies and gentlemen, moving on to the keynote session, please welcome Professor Hanan Balki, the Assistant Director General of AMR WHO. The floor is yours.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum and salamat baki to all. Honorable Vice Minister of Health, His Excellency Dr. Dante Harbonao, Honorable Minister of Agriculture, Honorable Minister of Marine Affairs and Fisheries, Honorable Minister of Environment and Forestry, Excellencies, respected colleagues, ladies and gentlemen. I am truly honored to be with you today and wish to thank the government of the Republic of Indonesia and the honorable ministers for the kind invitation. This event is a testament to the priority placed on addressing antimicrobial resistance as a health, a development, and an economical challenge, not only for members of the G20, but for countries of all economical levels. I would like to thank the honorable ministers for highlighting in their amazing opening statements the AMR and challenges from the different sectors, which very well sets the stage for this side event. And I would like to congratulate the government of the Republic of Indonesia on the progress achieved to date to contain AMR. Significant challenges do exist. Progress has taken place since the resolution of the establishing of the AMR Global Action Plan in 2015 and the conclusion of the Interagency Consulting Group Ad Hoc Committee established by UNGA 2016, concluding their work in 2019. Apart from the establishment of significant progress on the quadripartite Joint Secretariat and the Global Leaders Group on AMR, significant work has also been done in other areas. However, apart from the establishment of 148 countries developing their national AMR action plans, many have developed their aware classification of antimicrobials and established an AMR multi-sectoral committee at national level. The reality is only 20% of these plans are costed and budgeted. And as a result, the AMR response at country level is fragmented without rational prioritization or coordination of interventions. I wish to highlight to your excellencies and dear guests today 5 important gaps preventing us from bending the curve on antimicrobial resistance. First, there is the governance gap. Countries of all economic levels continue to struggle to establish effective multi-sectoral and sector-specific governance systems, which can be held accountable for the development, implementation, and monitoring of national AMR action plans. WHO is providing sector-specific support for the National Action Plan implementation, including guidance on a comprehensive programmatic approach of 6 relevant building blocks that covers all levels of the health system. WHO has outlined these as: first, effective governance and coordination, prevention of infections, access to early and quality diagnosis, including within the community level, universal access to appropriate treatment, affordable drugs and uninterrupted supply chains, and last but not least, information for action through comprehensive surveillance, research, and data analysis. WHO has also developed packages for intervention under each of these building blocks, which will guide the new generation of country-specific AMR National Action Plans 2.0 under the WHO People-Centered Framework for AMR. And I am delighted to see that the Health Transformation Agenda for His Excellency Mr. Budi very well resonates with the elements of this package of essential interventions: strengthening of primary health care, laboratory services, precision medicine, innovation, and a life cycle approach. On this specific gap, I am very happy to say that we are joined also today to hear more from our colleagues from the World Organization of Animal Health and the Food Agriculture Organization, who will elaborate in their presentations on these specific responses for their sectors. The second, there is a knowledge gap, where most countries lack strategic data to form necessary policy, interventions, prioritization, and to assess trends. Periodic national representative AMR prevalence surveys will result in robust AMR data and trends. While strengthening AMR surveillance based on routine diagnostic processes remains an important and critical goal, we have to realize that it may take more than a decade before this will result in representative and accurate country data for policy development. While periodic national representative AMR prevalence surveys will result in AMR data and trends are critical. WHO has established a unified protocol and is supporting piloting of this protocol in several pathfinder countries, and we are very thankful to the government of Indonesia for accepting to be among the pathfinder countries for this survey that will hopefully start later this year. The third is the diagnostic gap, which undermines effective patient care and also effective implementation of infection prevention and control. This specific gap drives the emergence of AMR through the misuse and overuse of antimicrobials and allows for the spread of multi-drug resistance within the community and healthcare settings alike. The WHO, in collaboration with partners, has established the Amr Diagnostic Initiative to assist countries to strengthen and innovate diagnosis of bacterial and fungal infections. The pipeline of diagnostics, including point-of-care tests, is promising and has the potential to bring easy bacterial diagnosis to the district and community levels. The argument that it will be too costly is not acceptable, as the return on investment may prove to be significant, as was proven for both TB and even more recently for COVID-19. Fourth, there is an investment and development gap with a small global pool of global donors. The G20 and the global community could assist by supporting the inclusion of AMR interventions in relevant financing instruments. The WHO, with partners, have established the United Nations Sustainable Development Corporation Framework AMR-specific guidance tool to support mainstreaming AMR into national development plans, plans, and linking AMR to broader development issues of One Health, pandemic preparedness and response, universal health coverage, primary health care, sustainable food systems, and environmental issues. And for the final gap, which I present very thoughtfully, is the potential hesitance of transparency on this topic. Not acknowledging this problem will only set us back. The reality is that we are all responsible for this AMR challenge, all countries and all sectors, and it can only be solved by bold and transparent recognition of the challenges and sharing both successes and failures so that we can move forward together and faster. The global community has learned a lot from the pandemic on the benefits of transparency of issues relevant to global public health issues. It has also learned the importance of resilience in healthcare systems at primary, secondary, and tertiary care level. The importance of access to diagnostics and vaccines, to infection prevention and control, of digital health research and development, of mobilizing partners, and the importance and relevance of global solidarity. These lessons, along with the long experience of tackling other critical important diseases such as HIV and TB, can and should be used to better inform the AMR response. I do hope that our presence here today will allow for us to build stronger health systems to address AMR and to ensure that antimicrobials remain effective for generations to come. So finally, I would like to thank the government of Indonesia and the G20 for their continued commitment, leadership, and financing to support the AMR response globally, and I look forward in reflecting and listening and hearing and sharing the reflections on successes and challenges during the upcoming 3rd AMR Ministerial Conference in Muscat, Oman, November of this year. Wassalamu alaikum wa rahmatullahi wa barakatuh. Thank you very much.
Thank you, Honorable Professor Hanan Balki. Ladies and gentlemen, now we please for the head of the AMRWOAH, Honorable Dr. Javier Marcos, to deliver his keynote. The floor is yours.
Excellencies, honorable ministers, and distinguished delegates, dear colleagues. First of all, we would like to thank Indonesia, as chair of this year's G20, for inviting the World Organization for Animal Health, founded as OAI, to make an intervention. We would also like to congratulate, and we are very delighted to see all the efforts that the Indonesian Republic is making in tackling this AMR problem across the sectors, because this is the only way we can really tackle this global problem. 90 years ago, humankind discovered a fantastic tool against infectious diseases, antimicrobials. We believed that they would make us invincible against them, and we thought that they would be endless. Even though Sir Alexander Fleming warned us all that during his Nobel Prize speech that human hubris made us deaf. Soon enough, resistance appeared, and however, we still thought we would be smart enough to overpass them, faster in adapting, discovering, and developing new antimicrobials. We thought we would always be ahead of them, and that we will finally win the fight. Here we are today. You have all understood and heard the number of 1.3 million people dead in 2019 only for drug-resistant bacteria. Around 75 tons of 1,000 tons of antimicrobials are used in animal health worldwide. Solely in the European Union, antimicrobial consumption is estimated to 130 milligrams per kilograms in humans and 108 milligrams per kilograms in animals. Only 27 new antibiotics are in the pipeline against priority pathogens with a questionable economic model. Research is tracking more and more increased prevalence in the pan-drug-resistant bacteria since 2017. We certainly made mistakes. Our assumptions were certainly wrong, but we can still change the pattern. Even though this is not an easy matter, we have the solution in our hands. The World Organization for Animal Health believes that prevention must prevail and is the most effective way to avoid antimicrobial misuse. It's only to be used when other approaches do not work. Prevention is possible by applying biosecurity measures, best-in-class husbandry practices, and by maximizing the use of vaccines across all sectors, humans, animals, and plants. Reducing the need must always prevail as the preferred option, and only when this fails, antimicrobial use should be considered. Only when necessary, responsibly, diagnosing before treating, and always under medical or veterinary supervision. So, if we know what to do, why is this not being systematically done or sustainably applied? Why are preventative or alternative approaches to antimicrobials not widespread? The complexity of sustainable implementation hinges on the following three areas the World Organization for Animal Health would like the G20 members to tackle completely. First, by investing in capacity building, equitably across the sectors. Inspiring examples of animal production without recourse to antimicrobials exist. We need to capitalize and draw on these experiences and effectively build One Health capacities across all sectors for sustainable change. We have the Performance of Veterinary Services Pathway, which provides a unique source of data highlighting well-identified national priority areas for governments and financial partners to focus their investment on, in order to strengthen animal health systems and their capacity to control, prevent infections, as well as AMR. In parallel, we would like to invest in science. There is a need to boost the number of prevention tools available. Modern husbandry practices, vaccines, immune modulation, diagnostics, drawing in innovation from the bench to the farm, to the bedside, and also to the fields. And last but not least, by accepting that AMR is not just another problem in modern medicine. Antimicrobials are the key enabling modern medicine. Treatment against cancer, stem cell transplantation, organ transplant, surgery, none of them would be possible without antimicrobials. AMR is the silent pandemic that we must address urgently. We all know what the world would look like without antimicrobials. For this reason, we must act together and act now. If we do not change our behaviors, infectious agents will get us all back in time, animal, humans, plants. The quadripartite partners are working together, enrolling all sectors and supporting them equitably to stop this silent tsunami. With your support, we will strengthen our focus preventing and controlling infectious diseases to use antimicrobial responsibly and sustainably. One Health is everyone's health. Thank you for your attention.
Thank you, Honorable Dr. Javier Marcos. Excellencies, distinguished delegates, ladies and gentlemen, last but not least, on our keynote session, we will welcome the UK Special Envoy on AMR, Honorable Professor Dame Sally Davies. The screen is yours.
It is a great honour to join G20's AMR side event today. Whilst I'm sorry not to be with you in person, I am thankful to and inspired, of course, by the leadership demonstrated by the presidency of Indonesia. As we, the world, continue to face this silent antimicrobial resistance pandemic, we must make sure that we continue to progress on AMR in the next decade, drawing on those lessons from the current COVID-19 pandemic. Global collaboration is surely the only way to stay one step ahead of pandemics, including AMR. So now is the time for strong and sustained action from all sectors and levels of society. As countries aim to live with COVID-19, we've got to make every second count and maximise every investment and initiative to prepare us for the pandemics we can see coming, as well as those we can't. We need to integrate AMR into global agendas for broader pandemic preparedness and prevention, to ensure that our mutual priority, protecting more people from infections with a sufficient resource allocation, is achieved. As you well know, action on AMR is part of pandemic preparedness and prevention. Actually, from a scientific perspective, we don't know whether the next pandemic will be viral or bacterial, and therefore we don't know what preventives, diagnostics, therapeutics we're going to need to respond to it. It could easily be a pandemic where the antibiotic treatment response is weak or non-existent, in defence of humanity. From a strategic perspective, many of the interventions we would put in place to detect, contain or mitigate infectious threats overlap for pandemics and AMR, including timely and accurate surveillance, equitable access to medical products. So robust One Health governance is necessary regardless of the source of the outbreak. Therefore, this is ultimately about maximising and leveraging the investments we're already making in pandemic preparedness by ensuring that they also support the work against AMR. It means breaking out of our silos and working across sectors and issues, because there are so many parallels with the fight against climate change, not least since AMR is also likely aggravated by biodiversity loss. To address AMR as a global G20 community, we need new preventives and diagnostics and therapeutics in the making now, with provisions for equitable global access and appropriate stewardship. We need capacity and capability for integrated surveillance, as today's discussion, leveraging the rapid investments and upskilling we've seen in the last 30 months around the world. We need to continue to collect and collaborate on data collection globally, with better data on antimicrobial consumption and resistance, which is accessible, usable, and interoperative. Data can shape our interventions and influence our investments. For example, we could and should integrate AMR into the WHO's new international pathogen surveillance network emerging as a result of COVID-19. Looking at our UK's Fleming Fund, the work has galvanised around the world assessing the real-world impact of AMR. I'm proud that the whole genome sequencing AMR regional centres were able to pivot to collect SARS-CoV-2 genomes across Africa and contribute to that early detection of the Omicron variant outbreak. An important aspect of the success of the Fleming Fund and the sequencing effort has been that close interaction and collaboration between different national and regional institutions, including the WHO and the Pathogen Genomics Initiative from the African CDC. I hope this can be a model for collaboration and integrated systems for our future. If you'd like to learn more about this initiative or the Fleming Fund Surveillance Partnership with Indonesia, please do visit our booth later today. The good news is we're already in a stronger position of global coordination this year than we were last year, with the formal integration of the UN Environment Programme into the quadripartite for AMR. We need a One Health approach at every level, from our G20 health, agriculture, environment and finance ministries working together, to community collaboration between human environment and environmental settings as well as animal, and the food chain. Further, we can encourage dialogue with the World Bank, which has financing available for AMR interventions. I'm so delighted AMR will be eligible for the new Financial Intermediary Fund, FIF, for pandemic preparedness and prevention. I also invite the G20 to work together with the One Health Global Leaders Group on AMR, of which I'm honoured to be a member of, alongside heads of state, politicians, academics and private sector, as well as civil society representatives. With the UN high-level meeting on AMR now mandated for 2024, the Global Leaders Group, together with G20 country missions in New York and capital policy leads, can plot a meaningful roadmap forward to that 2024 and beyond. Armed with new data on the scale of AMR, now is the time for G20 to decide how to put that data to use. We can ensure that AMR interventions can be maximised to reduce the risk of infectious diseases that may evolve into pandemics. Likewise, with coordination and planning, we can ensure that our wider domestic and international efforts on pandemic prevention and preparedness can decrease the emergence and spread of resistance. All countries can take steps here, starting with the developing and delivering of their AMR national action plans. And events like today's show that there is hope and an opportunity for global leadership, and they inspire me to believe that a world free of drug-resistant infections is possible, but it takes work. AMR transcends generations and G20 presidencies. So we look forward to working with Indonesia this year and in due course, India and other countries taking this agenda forwards. Thank you.
Thank you, Honorable Professor Dame Sally Davis. Excellencies, dignitaries, distinguished delegates, ladies and gentlemen. Now we will adjourn our event for 1 minute to allow the Vice Minister, Ministry of Health Indonesia, His Excellency Dr. Dante Saxono Harbuwono, to proceed with his agenda of doorstop interview. To our media friends, we please you to kindly leave the room in joining the Vice Minister for the doorstop interview. And to our honorable speakers of the next session, may I please you to move to the speaker seats that already prepared for you. Thank you very much.